When it comes to medications, it's important to be fully informed about the potential side effects. Geodon, generic name, ziprasidone, is a commonly prescribed antipsychotic medication used to treat bipolar disorder and schizophrenia. While it has proven to be effective in managing these conditions, there are some lesser-known side effects that patients should be aware of. In this comprehensive video, we will shed light on the lesser-known geodon side effects that often fly under the radar. From common symptoms such as dizziness and drowsiness to more serious risks like cardiac arrhythmias and neuroleptic malignant syndrome, NMS, we will explore the potential impacts of this medication on your physical and mental well-being. Our aim is to provide you with accurate and reliable information so you can make informed decisions about your health. By understanding the potential risks associated with geodon, you can have more meaningful conversations with your healthcare provider and ensure your treatment plan is tailored to your specific needs. Stay tuned for an in-depth exploration of the lesser-known geodon side effects and the steps you can take to minimize any potential risks. Common side effects of geodon. Geodon, like any medication, can cause a range of side effects. While some of these are well known and commonly experienced, others may be less familiar. It's important to be aware of both the common and lesser-known side effects to ensure your well-being while taking geodon. One of the most common side effects of geodon is dizziness. Many patients report feeling lightheaded or unsteady after starting the medication. This side effect is usually temporary and may subside as your body adjusts to the medication. However, if the dizziness persists or becomes severe, it is important to notify your healthcare provider. Another common side effect of geodon is drowsiness. It is not uncommon for patients to feel excessively tired or fatigued while taking this medication. This can impact daily activities and overall quality of life. If you experience excessive drowsiness, it is important to discuss this with your doctor as they may be able to adjust your dosage or recommend strategies to manage the fatigue. In addition to dizziness and drowsiness, geodon can also cause gastrointestinal side effects such as nausea, vomiting, and constipation. These symptoms are generally mild and often improve over time. However, if you experience severe or persistent gastrointestinal issues, it is important to seek medical advice. Lesser-known side effects of geodon. While the common side effects of geodon are often discussed, there are some lesser-known side effects that deserve attention. These side effects are less frequently reported but can still occur in some individuals. It is crucial to be aware of these potential risks to ensure your safety and well-being while taking geodon. One lesser-known side effect of geodon is orthostatic hypotension. This refers to a drop in blood pressure when changing positions, such as standing up from a sitting or lying position. Some patients may experience lightheadedness or fainting episodes due to this side effect. It is important to be cautious and take your time when getting up from a seated or lying position to minimize the risk of falls or injuries. Another lesser-known side effect of geodon is blurred vision. Some individuals may experience changes in their vision while taking this medication. If you notice any changes in your eyesight or experience blurred vision, it is important to notify your healthcare provider for further evaluation. Furthermore, geodon has been associated with an increased risk of seizures in some individuals. While this side effect is relatively rare, it is important to be aware of the potential risk, especially if you have a history of seizures or epilepsy. If you experience any unusual or unexplained seizures while taking geodon, it is crucial to seek immediate medical attention. Neurological side effects of geodon. Geodon can affect the central nervous system and may lead to various neurological side effects. While these side effects are relatively uncommon, it is important to be aware of them to ensure your safety and well-being. One neurological side effect of geodon is extrapyramidal symptoms, EPS. These include involuntary muscle movements such as tremors, rigidity, and restlessness. These symptoms can be distressing and may impact your daily activities. If you experience any EPS while taking geodon, it is important to inform your healthcare provider so they can assess the need for adjustments to your treatment plan. Another neurological side effect that has been reported with geodon is tardive dyskinesia, TD. TD is a condition characterized by repetitive and involuntary movements, primarily involving the face and tongue. It can be a long-term side effect that may persist even after discontinuing the medication. It is important to monitor for any signs of TD while taking geodon and report them to your healthcare provider immediately. Additionally, geodon has been associated with a rare but potentially serious neurological condition known as neuroleptic malignant syndrome, NMS. NMS is characterized by high fever, muscle rigidity, altered mental status, and autonomic dysfunction. It requires immediate medical attention and discontinuation of geoden. While NMS is rare, it is important to be aware of the symptoms and seek medical help if they occur. Cardiovascular side effects of geoden. Geoden can have an impact on the cardiovascular system, and it is important to be aware of the potential risks associated with this medication. One cardiovascular side effect of geoden is the risk of cardiac arrhythmias. This medication can prolong the QT interval, which is a measure of the electrical activity of the heart. Prolongation of the QT interval can increase the risk of developing irregular heart rhythms, such as torsades de pointes. It is important to notify your healthcare provider if you experience any palpitations, rapid heartbeat, or fainting episodes while taking geoden. Another cardiovascular side effect that has been associated with geoden is orthostatic hypotension. As mentioned earlier, orthostatic hypotension refers to a drop in blood pressure when changing positions. This can lead to dizziness or fainting episodes, particularly when getting up from a seated or lying position. It is important to be cautious and take your time when changing positions to minimize the risk of falls or injuries. Additionally, geoden has been associated with an increased risk of myocarditis, which is inflammation of the heart muscle. While this side effect is rare, it is important to be aware of the potential risk and seek medical attention if you experience symptoms such as chest pain, shortness of breath, or an irregular heartbeat. Metabolic side effects of geoden. Metabolic side effects are another aspect to consider when taking geoden. These side effects can have an impact on your overall health and well-being. One metabolic side effect of geoden is weight gain. Some individuals may experience significant weight gain while taking this medication. This can be distressing and may lead to other health issues. If you notice any significant changes in your weight while on geoden, it is important to discuss this with your healthcare provider to explore strategies to manage or minimize weight gain. Another metabolic side effect that has been reported with geoden is an increase in blood sugar levels. This can be particularly concerning for individuals who already have diabetes or are at risk for developing it. Regular monitoring of blood sugar levels is important while taking geoden, especially if you have pre-existing diabetes or a family history of the condition. Furthermore, geoden has been associated with dyslipidemia, which refers to abnormal levels of cholesterol and triglycerides in the blood. This can increase the risk of cardiovascular diseases such as heart attacks or strokes. Regular monitoring of lipid levels is crucial while taking geoden to ensure early detection and management of any abnormalities. Psychological side effects of geoden. In addition to the physical side effects, geoden can also have an impact on your mental well-being. It is important to be aware of the potential psychological side effects associated with this medication. One psychological side effect of geoden is the risk of akathisia. Akathisia is a condition characterized by an intense feeling of restlessness or an inability to sit still. It can be distressing and may interfere with your daily activities. If you experience akathisia while taking geoden, it is important to inform your healthcare provider for further evaluation and possible adjustments to your treatment plan. Another psychological side effect that has been reported with geoden is the risk of depressive symptoms. Some individuals may experience worsening of depression or the development of new depressive symptoms while on this medication. If you notice any changes in your mood or experience symptoms of depression, it is important to discuss this with your healthcare provider for appropriate management. Additionally, geoden has been associated with an increased risk of suicidal thoughts or behaviors, particularly in young adults. It is important to be vigilant for any signs of suicidal ideation and seek immediate help if you or a loved one is experiencing such thoughts. Managing and preventing geoden side effects. While geoden can have potential side effects, there are steps you can take to manage and minimize these risks. Open communication with your healthcare provider is crucial in ensuring your treatment plan is tailored to your specific needs. Firstly, it is important to follow your healthcare provider's instructions regarding the dosage and administration of geoden. Taking the medication as prescribed can help minimize the risk of side effects and ensure its effectiveness. Secondly, if you experience any side effects while taking geoden, it is important to report them to your healthcare provider. They may be able to adjust your dosage or recommend strategies to manage the side effects. Thirdly, maintaining regular follow-up appointments with your healthcare provider is essential. These appointments allow for monitoring of your progress and the detection of any potential side effects. They also provide an opportunity for you to discuss any concerns or questions you may have. Additionally, lifestyle modifications can also play a role in managing some of the side effects of geoden. For example, incorporating regular exercise into your routine can help combat weight gain and promote overall well-being. Eating a balanced diet and monitoring your blood sugar levels can also help manage any metabolic side effects. When to seek medical help for geoden side effects. While many side effects of geoden are relatively common and mild, there are certain situations where immediate medical attention is necessary. If you experience any severe or persistent side effects, such as chest pain, difficulty breathing, or severe allergic reactions, it is important to seek immediate medical help. These symptoms may indicate a serious adverse reaction that requires prompt evaluation and management. Furthermore, if you experience any signs of neuroleptic malignant syndrome, NMS, such as high fever, muscle rigidity, altered mental status, or autonomic dysfunction, it is crucial to seek immediate medical attention. NMS is a potentially life-threatening condition that requires urgent intervention. Lastly, if you experience any signs of suicidal thoughts or behaviors, it is important to reach out for help immediately. Contact your healthcare provider, a mental health professional, or a helpline in your country to ensure your safety and receive appropriate support. Conclusion: understanding the importance of monitoring and reporting side effects of geoden. In conclusion, geoden is an effective medication for the treatment of bipolar disorder and schizophrenia. However, it is important to be aware of the potential side effects associated with this medication. By understanding the lesser-known side effects of geoden, you can make informed decisions about your health and have meaningful conversations with your healthcare provider. From common side effects such as dizziness and drowsiness to more serious risks like cardiac arrhythmias and neuroleptic malignant syndrome, NMS, geoden can have a range of impacts on your physical and mental well-being. It is crucial to monitor for any side effects and report them to your healthcare provider for appropriate evaluation and management. Remember, each individual may respond differently to medications, and what works for one person may not work for another. Open communication with your healthcare provider is key in ensuring your treatment plan is tailored to your specific needs, and any potential side effects are addressed promptly. By staying informed and actively participating in your healthcare, you can ensure the safe and effective use of geoden as part of your treatment journey. Thanks for watching.